Welcome to this week's edition of the Yamhill Leadership Roundtable. It's in some ways it's too bad that we have to keep meeting virtually because we have a pandemic still with us. But we have today Pauline Matoxen from Encompass Yamhill Valley and NAMI. I'm Casey Kulla, Yamhill County Commissioner. We have Mayor Rachel King from the City of Amity, who may now be permanent interim mayor, or currently the interim. We'll talk about that later. Yeah. We have Mayor Linda Watkins from the City of Carlton. Coming on in a moment here is Howie Harkema from Encompass Yamhill Valley. And then we have Director Lindsey Manfrin, our Health and Human Services Director for the county and the leader of the COVID response for our community. So welcome everybody. And Director Manfrin has only a little bit of time, so I'm gonna ask her to go first. And I've invited Director Manfrin on, try to keep it to a minimum, but she has generously agreed to come on so that we can talk about the COVID response in our community, how hospitals are doing, vaccination rates and status, and how leadership here can help Director Manfrin. So welcome and thank you.
Thank you so much for having me. I'm happy to be here. I'll give sort of a brief snapshot of where we're at, and then I'd be happy to take any questions if there are any for sure. Current case counts have continued to rise over the last several weeks through the month of August, although the last about 2 weeks we've seen the incline has been less steep, which is good, but still increasing. The latest projections from OHSU are showing that it's likely that this week will be when we're peaking with case counts, although we are pretty unsure of how both school and the Labor Day holiday and weekend might impact those things. Assuming that those projections are sort of still on track. The other important projection is really looking at hospitalizations, which is anticipated to peak early to mid-September. So here in the next week or so, we're anticipating that peak as well. They're projecting that peak to be at about 1,200 individuals. Certainly, as you're hearing in the media, as you're hearing from our hospital representatives, that hospitals throughout the state are very taxed right now, and there's a lot happening, and individuals, really a lot of individuals needing hospitalization for COVID, and of course, all of the other things that people typically need to be hospitalized for have not gone away either. Currently, when we look at hospitalizations and just general cases, 84% of all cases are in unvaccinated individuals, and 95% of all hospitalizations are in unvaccinated individuals. Those are statewide numbers, and generally speaking, I would say Yamhill County is really kind of following in that same footstep as far as what our percentages look like. One positive thing that we have learned a bit more information about is how the Delta variant is impacting children. So we know that Delta, of course, is spreading much more rapidly with both kids and adults. And we have seen that it's causing more severe illness in adults. And so there was a lot of real question around about how it's impacting our children, because we've seen cases increase, we've seen hospitalizations, pediatrics increase, but the latest information from the CDC is really showing that while those cases and hospitalizations are impacting or increasing, the percentage of those that are experiencing severe disease has not changed, meaning that we are seeing more hospitalizations, but that's because we're just seeing more cases in general, and that it doesn't seem to be impacting kids more severely than it had previously, which is sort of a silver lining, I think, particularly as today is the day that many kids go back to school. We continue to see vaccination rates climb as of the 2nd. So last week we were at 64.2% of people in Yamhill County who are eligible, so 12 years and up, have received at least one dose. We've seen some pretty significant increases, as I said, over the last 4 to 6 weeks, where we were seeing, roughly 200 a week, and then we had slowly, gradually increased to 400, 800, with a peak around 11 or 1,200 vaccines in a week, and now we've sort of leveled off at around 800 to 900 per week and have been there for a couple of weeks. So we're definitely seeing more people get out there and get the vaccine. Anyone who's interested in getting the vaccine can certainly look at the public health webpage, and we have a list of all the community clinics we have, and then as well as places like healthcare providers and pharmacies are certainly still offering those. There's also a third dose that is available for people who had one of the mRNA vaccines, so the Pfizer or Moderna vaccine. That third dose is an option for individuals who have some sort of immune compromising condition or take certain medications that might compromise their immune system. And we're really saying, for those folks, getting an additional dose is really important to help boost that immune system and that response for them. In terms of booster shots for the general public, we're getting a lot of questions about this, and we don't have a lot of great answers. Certainly we're waiting and nothing will happen our end until the FDA approves those booster doses, which will be done per vaccine. And then the CDC's Advisory Council on Immunization Practices, or ACIP, we'll have to review that as well, and then the recommendation for booster shots will come out. What we don't know is if it'll be a general blanket booster recommendation based on time frame, or if there'll be any sort of parceling out various populations that might be at more risk or things like that. So we're still just really waiting to get more information on that. We're also still waiting to get more information on when younger kids will be eligible for the vaccine. The latest projection or forecast that we've seen has really indicated that November is at this point the most likely time that we will see that vaccination eligibility age drop from 12 down to 5. So certainly we'll be providing more information to the community through the various channels as soon as we learn more about that. But at this point, it's all just sort of forecasting. We've known that testing has been something that's been needed over the last few weeks as we've seen cases increase, as we've seen healthcare providers get more busy. It's been increasingly hard for people to get tests. And so Yamhill County Public Health has worked with the Oregon Health Authority, and we now have 1 or 2 community-wide testing events happening per week. Those can all be found on the Yamhill County Public Health webpage, a list of the dates and where to go. They are events that, except walk-ins, there may be a line. I know there was a bit of a line at the last one, but there were over 150 people tested at that last one. People are able to pre-register, but it's not required. The most recent one that we have planned for this week, I know there were 150 people, I believe, registered. And so we anticipate seeing more than that, just because we certainly anticipate that there'll be walk-ins and folks wanting to come in that way. So we're really working hard to provide access for people to get tested, both so that people can easily access it, but also because we're really trying to steer people out of our emergency departments unless they're actually needing emergency care. So unless they're needing emergency care, that is not the place to go to get tested. And so we're doing what we can to increase other options for people for sure. The last thing that I'm thinking might be of interest is the monoclonal antibody therapy. I know there have been some questions about this. That is really, it's a treatment for individuals who have been exposed or have COVID, ideally before 10 days after their exposure or after they begin getting symptomatic. And it is a treatment that, again, it's not a replacement for vaccine. I get that question a lot. Is this something you do instead of? And the answer is no, it's not preventative. It is really a treatment option. It's a therapy option, but it's shown to be quite successful in the population that it is meant for, which are generally people with underlying health conditions or some other risk factor that puts them at more risk than the general public for severe outcomes. And so the reason you're hearing a lot about it these days is because historically it's been available, but it has been only available through a 4-hour infusion that has to be done at an infusion center. And so as you can imagine, that in and of itself made it very limited in terms of access for people to be able to go out and do that, but also for the volume that clinics and places, infusion centers could do if they had to have people there for a minimum of 4 hours, because there's the infusion, but then there's also an observation period. And then when we're talking about the individuals who are eligible for the treatment, generally they're individuals that are at higher risk. And so they want to be very mindful about not having a bunch of people packed together who all have COVID or have been exposed and those types of things. So they've got to be very mindful about those things. But very recently, within the last couple of weeks, it was authorized as an injectable medication now or treatment now. So people can get it through that. It still has some logistical challenges for many clinics. It requires a 1 hour waiting period after the injection is given, but it certainly is making it much more accessible. And so we do have some clinics locally that are able to offer that to their patients. They're only offering it to patients that are seen in those practices. But for people who may go to a practice where that is not available in the location, their healthcare providers can provide them, diagnosis. They need to be diagnosed, and then they need to be make sure that they're eligible for the therapy, and then they can do a referral, and that another organization will call them to get them scheduled to actually get the treatment. So really the best thing someone can do if they are interested or feeling like they need to seek that treatment is to connect with their healthcare provider, and they will get them directed. If there is someone who does not have a healthcare provider, people can certainly contact us at Public Health, and we will do our best to get them connected with someone who can get them that treatment. But we'd like to limit that just to those folks that don't have a healthcare provider. So I think those are kind of the highlights of things happening. Again, happy to answer questions.
Awesome. Well, thank you very much, Director Manfrin. How is staff doing at Public Health, since you're really the front line of responding and contact tracing?
Yeah, I think overall folks are doing okay. I think it's, it feels like the whirlwind that just won't end. And I think there's a lot of, I guess, I don't know the right word. I want to say sadness. I want to say disappointed when we all really felt like we were kind of, the light at the end of the tunnel was coming, and then sort of August hit us all, and not only was it the things that we've had to manage sort of throughout the pandemic, but we were having to manage them all at once. Whereas before, we really mounted our response to case investigation and testing, and then we were really able to focus on vaccination rollout, and in the backdrop of all of that was wanting to make sure that we were prepared for hospital surges, and that our funeral homes were prepared for surges, and all of those things. And then all of a sudden August came, we're having to do all of those things all at the same time. So it's been a lot, but they are an amazing team. They are dedicated, and they show up every single day for this community, and work their tails off.
All right, thank you. It looks like Mayor Watkins has a question or comment for you.
Just a comment. A friend of mine, in fact, last week had to go in and do a COVID test, and she went to the county, kind of cattle call area, and she was appalled. Her comment was how disappointing and sad she felt watching the way so many people were treating the staff, and the attitude from people that were in there getting a free test because they might be sick, basically being abusive to the staff and the folks that were trying to do this for them at no charge. And she just was commenting that the staff was wonderful and everybody was great, and they were very gracious and very graceful, and she really appreciated all of their hard work.
Yeah. Thank you for sharing that. Appreciate it.
That along.
I will say the little bits of thank yous go a long way to our team. They're making calls people don't necessarily want to be on the receiving end of, and sometimes folks are not always the nicest to them. So those moments when you can say thank you are much appreciated. So thank you.
And I think that Mayor King also had a comment or question for you.
Well, I will echo the thank you for your work and your team's work, and just for being here, all this information. And then a question is that today at the governor's press conference, we heard some additional information about something that we talked about last week, and that was the opt-in testing for schools. And so it sounds like they'll have the diagnostic testing on site for symptomatic kids or staff, but also weekly screening options. Is that something that Yamhill County Public Health will be encouraging and talking to all the different administrations about, and getting that to our local schools?
Yeah, absolutely. I strongly encourage all three options when schools are able to manage to it. And certainly schools will have to figure out what logistically they're able to do. Certainly having tests available on site should someone become symptomatic at school is helpful. And then the surveillance testing for both teachers and students, I think can be really helpful. We estimate that probably surveillance testing, if it's done weekly, probably picks up around 50% of cases or so. So, it's not an end all be all, but it is still helpful depending on the volume that you're doing. Certainly, doing 1 or 2 tests is different than doing, a large chunk of the group. But we definitely encourage all the schools. Our schools have been great to work with. We meet weekly with them. We took, larger chunks of time off during the summer, but certainly are ramping up those weekly meetings again with the superintendents and some key public health staff, which have been really helpful so we can talk through all of these various things that might come up.
Thank you. And then I have one more question. They talked about for contact tracing purposes in the school that for exposure, it would be masked within 3 feet and unmasked within 6 feet. Is that a blanket statement that all schools are going to need to be following as far as letting people know about exposures?
Yes, and that will same with public health as well. That's what we would be considering those parameters when we are either requesting and telling someone they should isolate or giving them a quarantine notification. It is important to note that it's just in the classroom setting. Outside or on buses, it is still the 6 feet. It's just in the classroom as long as folks are masked. And it's student to student, the 3 feet is being allowed. And largely we're trying to do as much as we can to keep kids in the classroom and to keep kids there. And hopefully, with the use of the face masks, we'll be able to contain things within the classrooms.
Thank you.
Super helpful. So Director Manfrin, what's our test positivity rate in the county? I know that's been a number that we've grasped onto at times and had struggles with. How is that reflecting what's happening in the community?
So as of Friday, it was 11%. We've been seeing it toggle between really 10 to 15 or 16% over the course of August. Yeah. We want it below 5, so that's not a good number. That's not a percentage we want higher. It really is indicative of wide community spread, right? That's what that number tells us. It can also mean that, we want more testing, which has been part of our goal to get more testing access to people to ensure that we have availability of testing for people. We've been seeing pretty astronomical positivity rates throughout the state. So there are some states that have been over 30% for multiple weeks at a time as well. So, compared to some other counties, it's not as dire when you look at it through that lens, but still, again, that is nowhere close to where we want to be from a positivity standpoint.
Yeah. Okay. Thank you. And then you may have answered it just in the 11% positivity rate, but when public health is doing contact tracing, what are some of the major sectors? You used to give us back in the day, this is how many are in this area and this is how many are in this area. Do you have a sense of that right now? Are you keeping track?
I don't have a sense of that right now. I mean, we have that information that we can pull, but I haven't seen it, and things change so rapidly these days that unless I've seen it in the last few days, I'd hate to quote something incorrect, but we can definitely follow up and get that information.
Yeah. And I was going to say it, in some ways it's that it's everywhere. So yeah. Your job is clearly, your crew's job is just to let people know and to get that information out there. Yeah. Okay, great. Thank you very much. Are there other questions for Director Manfrin? Oh, yes, Mayor Watkins.
Real quick. How much recidivism are you seeing? How many of these cases that are coming in are repeats?
We have not had a lot of those. I was aware of a handful, and right now the measure for that is a case that's tested positive again at least 90 days from their previous time they tested positive. So that's the time frame we're looking at. But that's something else that I can pull some data and we can find out more definitively.
I was just curious.
Yeah.
Thanks.
Yeah, it would be good to know. I do know last week we were talking about the is it more transmissible or less? Is it more virulent or less? Has it done any kind of immune escape? And it sounds from what we are hearing like Delta isn't in any kind of immune escape route. So that's positive, right?
Yeah, that is, and that's
very positive. Yeah. And then where are is it that there are more young people who are getting vaccinated now, which is bumping up numbers, or is it across the board? Because this is a really significant increase.
It really is. And I think it seems to be kind of across the board. We're seeing more and more people get vaccinated. We're seeing, especially when we're talking about 50 and under, I think overall, the higher age brackets, we had pretty substantial uptake of vaccine right away. And it was sort of the younger age group that there was fewer folks vaccinated, and that's where we're seeing a lot of that growth. But and I think there's a lot of factors that play into it, for sure. There's definitely, I think, multifactorial.
Okay, my last question for you, Director Manfrin, is I've seen a lot of information about how N95 or KN95 masks are effective, but cloth masks are less effective. Is there still remaining like an official position of either CDC, OHA, or Yamhill County Public Health on? Is it just like any mask is more better, as it were, than not, or is there a hierarchy from the perspective of public health?
Yeah, I would definitely say that there is a hierarchy when we're thinking, particularly when we're thinking about providing care to someone with COVID-19, right? That's when we want to make sure that someone's wearing an N95 and that individual has been fit tested so we know it's actually functioning, and providing the appropriate seal and things like that. When it comes to cloth masks, I would say not all are created equal, right? I was joking, I saw someone, out and about the other day wearing a crocheted mask. That probably is not very effective. I've seen mesh masks, things like that. I would say I don't think that that's an effective mask. Usually we're looking at between minimum of 2, ideally 3 layers when we're talking about cloth masks are going to be the most effective for sure.
Okay, thanks for taking that one on. All right, any more questions? Comments? Okay, great. Well, thank you very much, Director. It's very helpful to get you on. And please send our thanks to the team at Public Health and the marathon runners who wish they weren't running the marathon.
I will do that. Thank you.
Yeah, thank you very much.
Take care.
And then I'm going to call on Mayor Rachel King for the city of Amity, who is or is not interim still. I apologize that I didn't watch your meeting.
Oh, no, that's fine. So I was appointed to the permanent position, so I'll be serving out the rest of the term for the next 3 years. I apologize because I have Director Manfrin's face frozen on my screen. So hopefully you guys are hearing me well. So I was appointed, and Councillor Napua Rich is now the council president for the city of Amity.
All right, congratulations. And I can hear you and I can see you. Okay. Yes. All right. Great. Well, what would you like to share with the people of Amity then, besides that momentous news?
So at the last meeting, we did get our city code of ordinances passed. So that was effective immediately. We're really happy about that. With Amity's, the direct to Amity ARPA funds, we are going to be replacing all of the city's water meters with new fancy Wi-Fi. You can drive by and get an accurate reading. So those are going to start being put in September 20th. And within 10 days, we should have them all switched out. So I think we're all really excited for that. It's been a long time coming, a long time overdue. And then one last thing is we had the crosswalk sting here. The sheriff's office did that for us at the end of August. And within 3 hours, they crossed about 80 times. And we haven't got the official report, but about 10 tickets were issued during that 3-hour period. So I'm glad that their presence was here, and I hope it makes a positive difference.
Well, very nice. Can you tell me, I mean, I know because I like water, but can you tell me for the city, for Amity residents, what's going to be the benefit of the essentially smart water meters?
Yeah, so I'm not an expert, but I've heard a lot about them. And really, some of these water meters we have in town are old and probably not working as they should be. And so just to get an accurate reading is going to benefit a lot of people. You know, there could be leaks right around there, or it's just been off every month. The other thing is we contracted out to have our meters read. And because these, you can drive by them and get your reading, you know, Bluetooth or Wi-Fi, however they do it, we'll be able to end that contract and save the city money. And I'm not sure about the details, but at some point, residents should also be able to have a more accurate and clear look at their own water usage, which should be helpful for conservation or just keeping track.
Yeah, definitely. That makes sense, especially when you've been spending so much time and effort and money on water systems. It's clearly, it'll be really good to know what's happening with the water once it gets places, right?
Yes, and I bragged last week about the 1 million gallons we had saved with the improvements we had done so far. And I got an update at the meeting that it's actually 2.01 million gallons we are saving at this point now because of the improvements that have been done.
Very, very nice.
Yeah, from August to August. So that's great. And we're going to keep working on it.
That would fill the city of Yamhill's reservoir. That's how much water that is. Okay, well, that's great. Thank you very much. And it looks like Mayor Watkins either had a comment for you or maybe she was going to give us an update.
Well, I had a comment. We went, when talking about the water meters, we went to the remote reading water meters several years ago. I think they started putting them in about 3 or 4 years ago and just worked along. But those things are amazing. I went into the, as far as accuracy, I went into City Hall one day just to see my readout and stuff. I mean, they were handing me a printout that showed hour by hour how much water and where the water was being, practically where the water was being used. But it was like, okay, at 6:52 p.m. you used, it's a little bit eerie, but you're going to know exactly where your water is being used and what you're using it for.
That's pretty great.
Yeah.
Like, oh, yeah. I remember I started the laundry.
Yeah, it's like, I mean, there's one on there for like, 3 a.m. And I'm thinking, what did I do at 3 a.m., But it's a good way also to figure out where your leaks are, because if you are having leaks, because if you start seeing water usage at a certain place and time when you would not normally have water usage, you might have a problem. So yeah, they're really interesting.
That's great. I recall that the LA Water Co-op, which I always forget what LNA stand for. It's something Laughlin to Albertson, maybe, which is really spread out, and they buy water from the city of Hillsborough and then their rural water district. They did that because they're so spread out. There's not the density of home. And so they found it really effective for searching for those leaks.
Yeah.
Well, that's great.
Go ahead. Sorry.
I think it will be really beneficial for seeing those outliers, or if there's a problem going on. And we've been, so with like new builds and, we've been asking that these be put in. So we have already seen what they can do, but just to have the entire town switched over is going to make such a huge difference on the city's end and then also on the customer.
Totally.
Well, there are also customers who are going to find that the accuracy increases their water bill. So it works both ways, but be prepared.
It's a good point. Good point. Yeah, be prepared for these comments, I'm sure. Well, Mayor Watkins, what else would you like to share with community today? And thank you for joining us.
I turned myself off and forgot. Yeah, thank you. I just also want to really thank you for putting these together. I mean, even at times like this where we're not having maybe a huge number of people, these have been just, these roundtables have been really invaluable. And I really, really appreciate them. It's, especially when you're working in a city, you get kind of locked into the city and forget, yes, exactly, there's a lot of tunnel vision. And so it's really nice to hear from other people and know that we're all kind of dealing with the same things and headed in the same directions. And it's not just me being nuts, it's encouraging. So what we've got going on right now is we're working on the bid for the Han Creek sewer pumping station, which is part of some of the stuff that DEQ is requiring us to do. So we're getting the bid on that. We've also put out an RFP for a contractor to handle the updating of our city comprehensive plan and our planning code. This was something we were planning on doing this year. We thought we'd probably have maybe a year to do it before we were faced with another subdivision. Instead, we're going to be scrambling with it because September 20th, we're doing a hearing on a new subdivision. Well, it's a new zoning change, but that's what's going in there. So I don't know. We're just kind of scrambling to get that done and want to get, but that's going to take a year to even get a new plan updated. So it was kind of sad to see and we have multiple pre-conference, pre-planning conferences going on too, I guess. I don't hear about those until afterwards, but so Carlton is growing in spite of itself. That wasn't exactly the way we planned it to happen, but it never is it? This evening, of course, is our council meeting, and one of the things that we're doing, we have basically an entirely new council. I mean, we've got one counselor that's been on there more than a year and a half, and we've got two counselors that have been on there more than 6 months, practically. So we're having the insurance company that we work with come in, and this is part of our continuing ed for counselors. They'll be talking about the potential for exposures and the protections that as a public servant you need to be thinking about and be aware of. So we're trying to help our counselors become better educated and understand, all of the aspects of the process. And I think I'm going to shut up now. That's probably enough.
All right. Well, thank you, Mayor. It's a good update. And I recall Council of Governments also does a training for counselors if they need it too, but mostly around public meeting laws, conflict of interest laws, that kind of thing.
Yeah, the COG does, and it's a one-day seminar that's on exactly what you were saying, is government basics. Yep. Because a lot of people come in and they're just not aware of a lot of it. But we're trying to get more information to them than just that. We want them to be a little more rounded in things like exposures, but also in things like how you get something done. As in, we need the comp plan redone. How do we do that? What are the steps that we take? What is the process? Or if we don't want a zoning, how do we, hold a hearing, or what do you do with this stuff? So that we actually have a council that is confident with and understands what they're doing. The other thing I was very sad about is that the League of Oregon Cities annual meeting over in Bend has been canceled. Thank you, COVID. So I was really looking forward to that, and some of the networking that goes on at those kinds of those events. But
yeah, all the better than to have a little training for your own team.
Exactly. Yeah.
Well, both of you, both mayors, you'll appreciate this, that I got a request recently that because of the low amounts of water, that I should immediately stop all development within cities until we have a desalination plant. So I just want you to know. Sorry.
Could you get that done, please?
Yes. But I realized that to me, it was a really good opportunity to remind people of how it's not like saying that something's not our jurisdiction isn't a passing off of responsibility. It's an acknowledging that it really is your responsibility. It's not like, oh, no, we're not going to deal with that, and it's a cop out. It really is like your community elects you to make those hard decisions.
Yeah. I have started, and it's on my, if you have time because you have nothing better to do than read other people's stuff. I've started on my mayor's Facebook page, and also there's a mayor's corner on our city website that I am doing commentaries on, and a lot of them are exactly that. Like a couple of months ago, we got a tour, another counselor and I got a tour of our whole water system. From here in the sewer system back up to the reservoir. So we get to see the whole thing. And I did a commentary on it that was just, okay, guys, this is what we did, and went through the whole thing. The response that I'm getting from those has been really great. I don't think there's a week that's gone by that I haven't had at least one, if not more than that, people come up to me and say, thank you for doing this. I understand better now what's going on, to include the zoning. I mean, the minute we got the notice of the zoning change, I put that up there, and I explained to people, yeah, I know that you don't want this, but you need to understand that if you come into these hearings, you've got to be able to have a legally based reason why you're protesting this, that just saying I don't want it because we don't want growth is not going to work, that you have to be able to understand. And it seems to be helping a little bit with the frustration levels that folks have about why is something happening. Our staff put together a printout that was basically a history of Carlton's water system. They did an amazing job on that, and it's posted up online, and it makes all the difference in the world for the people who've been complaining. There's still people that complain about the cost of our water, but at least they understand why it's what it is, and the sewer. And just having that information out there, hopefully none of our people are telling you that because they should know better, but you never know. Anyway.
Clearly you've taught them well. Yes.
Communication. I used to be a PIO for elected state officials and a state agency over in Idaho. Mm-hmm. And I learned from that job what people need to hear. So we're trying to do our best to do exactly that.
And it turns out that the things that you know, Mayor, aren't actually the things that other people know. So if you tell them, exactly, then they'll know it.
Exactly. You know, we're so inundated with this stuff, and we're so involved in it that we forget, I think, to a certain point, that not everybody knows this. And they don't, as you said, they don't understand the difference between what our county and our city government does. And, you know, they think the mayor can go tell the president something, and it kind of doesn't work out very well.
It doesn't? Oh, okay. No. Okay. So, well, it'd be good to not have the president tell you what to do either.
Exactly.
Yeah. Well, I was thinking about that in terms of bridges, because, you know, the Yamhill County has bridges that have had in the past varying levels of failing, and that's structural is different than just design. But I forget that I should update people on we're making progress on these bridges.
Yeah.
Yes. But speaking of that, can you remind me, Mayor King, what the time frame is on the Salt Creek Bridge for ODOT? When is that really getting going?
So I believe, according to the STIP, they are going out to bid in January of 22 for that project, and it will be underway in the spring of next year. That's ODOT's portion of pulling down the bridge and rebuilding it. And now the city of Amity has actually aligned our project because we need to move that transmission line that is currently attached to the bridge. So our timeline is running right beside theirs. Obviously, before it's down, we'll get ours off and relocated to where it needs to be for the time being. But yeah, so coming up in January, they should be starting.
Okay, it's exciting, but also terrifying since you need to get your water pipe moved. Yeah, and I'll give you the like short version is that with the water and sewer infrastructure grant program at the county, that our county staff are in the very early stage of putting together a request for proposals that will go out to cities and water and irrigation districts with these are the things that we'll fund and here's what we need from you for a request. So it is moving forward and hopefully on a timeline that's similar to what the city of Amity needs. Yeah.
Yes, thankfully our bases are covered. It's just that because this project has drawn on so long and there's been so many changes, we're really just, as new information and plans and engineering come in, we have to pivot with what we can do and what we need to do. So I appreciate hearing that and knowing that, we'll reach out to you for sure. Thank you, Commissioner.
Yeah. And then I wanted to check in. We have both Pauline Metoxen and Howie Harkema from Encompass Yamhill Valley. What would one of you, whoever wants to give an update, like to share with the community today?
Thank you, Commissioner Kulla. Can you hear me? First of all, a non-Encompass Yamhill Valley item, the McMinnville Free Clinic, of which I'm the vice president, had to shut down again due to the Delta variant. And too many of our volunteers were not vaccinated, and we were worried about that. And we were also worried about people coming into First Baptist and possibly contaminating First Baptist as a whole. So we've shut it down again. We will let everyone know, of course, when we reopen, hopefully soon. Next thing is Encompass Yamhill Valley took the response, especially Pauline Metoxen, and she can talk about this, the homeless that were under the bridge that contracted COVID. And one gentleman was taken to the hospital and then released. And there are at least 12 people down there under the bridge. We appreciate that the NR did an article at least to let everybody know. We thank the McMinnville Police Department for not rousting them out of that area so that they can quarantine. We appreciate that very much. Other things that are going on at the library on Sundays, we do with utilizing our funds now. The Unitarian Universalists do a Sunday sandwiches from 1 to 3 p.m. So if anybody is in need of a lunch on Sundays, which was the only day that we weren't feeding in McMinnville, you can go there from 1 to 3 and get sandwiches and fruit and water and things like that. I'd ask Pauline to jump in at this point and talk more about the people under the bridge. Are you there, Pauline?
I am. I don't know that I have a lot more to share. We've worked with Director Manfrin to try to get resources for people in the community and people there under the bridge, and to work with MAC PD to leave the homeless camps alone, because as rapidly as this has been spreading through that community, I think it would be best practice for everyone to assume that all the camps are exposed, because this population is very intertwined. So it would seem like we should just leave people where they are and try to support their getting healthy wherever they are. That's about all I have to say today, Howie.
That's fine. Listen, I'd like also to thank Provoking Hope for stepping up to the bat to help with food, water, supplies that are needed in these camps. And I know that Casey's going to call me soon, and we're going to talk about how Encompass can also be involved as well as Provoking Hope. So I'm expecting that phone call, Commissioner. Thank you to Rachel King, Mayor of Amity, for joining us at our last mayor's talking about homelessness in Yamhill County. Really appreciate the input very much, Rachel, and I'm so glad that you were able to attend. Thank you for that.
Thank you, Howie. I was going to say a thank you to you. It was a very informative meeting, and I got to hear more about what you had to share, and I really enjoyed it. So thank you.
That's all I have, Casey.
And then thank you, Howie. How can folks out in the community help both Encompass Yamhill Valley, Provoking Hope, and folks who are camping as the virus spreads through the communities and as they need to quarantine? What can we do now?
Well, I know there's going to be supplies needed, whether it be water, Gatorade, food, fruit, whatever it is that they need. As we hear more about this in the coming days, we'll know more. However, at this point, I would say donate those items to Provoking Hope so that they can be taken down there to multiplicity of sites probably, and treat it just like we did when we did the emergency heat problems through the summer. Don't hold back your donations if just because it's a homeless population rather than a community at large. These people are our houseless neighbors, and we need to support them in every way that we can and keep people safe. And this is just another piece of that puzzle.
All right, thank you, Howie. And that's a good reminder that folks who are trying to quarantine and are, say, under a bridge or in the woods, they also are going to need to go out and get food and water, which exposes other people in the community to virus. So it's a really good point. Keeping them safe in their locations is a really important part of this. And it looks like Colleen also unmuted herself, and then Mayor King as well. Colleen, do you want to add?
I would just add that blankets are also beginning to be needed. One, because people are sick, and two, because it's getting cooler at night, so people are getting cold. So if you have extra blankets, sleeping bags, whatever, that would be useful.
I'd like to give a shout out to Chief Scales for sending the police down there to do the tests. I thought it was a public health item, and the McMinnville Police Department decided to take it on and get the tests down there. So we appreciate that very, very much.
Thank you, Howie. And then Mayor King was going to add something as well. Mayor, you're still muted, I think.
Availability had changed at all with the motel sheltering program, and if you anticipate that as the summer season ends, that more options will open up for that.
I'd like to talk about that.
Yeah, please
First
do.
of all, they're overbooked right now, and they have a waiting list, and it's all based on medical need. So right now, there's no possibility of getting people in due to the tourist traffic as well as all of the other. So we know that Alexandra at YCAP, and Lindsey Manfrin at HHS is working diligently trying to find motel rooms for the people that have COVID and bring them out one by one or in pairs, however it is necessary to do it. But with the lack of availability right now, we're kind of stuck between a rock and a hard place. So we're doing the best that we can with what we've got.
And the dog added that little emphasis, exclamation
yes, he did.
Yeah, it's a good question, Mayor King. There is a lot of with the Project Turnkey Motel having opened. There's a lot of potential space and slots, but the list of people who are waiting and who are in need is very long. And it's a really good thing to have the space, but it's also really heartbreaking to see that we can't get people into spaces when they really, really need it in crisis. And Mayor Watkins, you were going to add something.
Oh, no, I was just laughing. Right when your dog barked or whatever, was that your dog that was woofing?
I think it was Howie's.
Oh, when that dog barked, the neighbor's dog was barking, and I was trying to figure out how the neighbor's dog was. Like, God, this has a really good speaker on it, doesn't it? It was like stereo doggies.
Stereo doggies. Okay, well, thank you for that update, Howie and Pauline. And then Director Manfrin gave us the update on COVID, but I did want to note that today is the 1-year anniversary of the firestorms that swept through many of our communities and crept very close to and just across the border, obviously at the north end of the county. And so I just wanted to reflect upon that and express a lot of gratitude for everybody who responded to their neighbors, helped each other out, got animals to the fairgrounds, fed people at the fairgrounds. The community emergency response team that operated all the roadblocks to keep people out and keep people safe as first responders were coming and going. You all probably remember it just as well as I do, but there were a lot of people in our community who were very scared last year at this time. And I know I'm very grateful for both of you, for your leadership, for Howie and Pauline, in helping people at the time and also helping with recovery. When I talk to folks, especially from other communities, there's still a tremendous amount of trauma and flashbacks and moments that trigger them to get really scared and really anxious. In some cases, just because they were evacuated, in the night because of a fire near their home. Even though they didn't lose anything, there's still a lot of anxiety there. So I just want to thank everybody for your work on that and remind you that it's okay to be anxious about it. It's okay to be scared, but definitely seek some help if you need it. And Howie unmuted himself. I don't know if you wanted to add anything.
I just wanted to thank you for doing that, Casey. There were so many people at the fairgrounds and out at the Spruce Goose area and all of that at the same time. And so many people jumped in to make sure that people were fed, had the clothing they needed. They had the blankets and food and everything they needed. But people are still in that situation. People have not rebuilt yet. And if you look at the Mill City right now, they're still in the midst of rebuilding. Idana is still in the midst of rebuilding. Detroit, and none of those townships may ever be the same after all of this. So I thank you for reminding everybody that wildfires just seem to be a thing of our present time, and we have to be super, super cautious about how we light fires and don't.
Yeah, absolutely, Howie. I do want to note that to show that we can learn from this, from other people's challenges, in Southern Oregon, FEMA has rejected in the past up to 75% of the applications from people who for housing and emergency assistance from people who would have been eligible except for the lack of proper documentation of either their possessions or their cars, whether they owned their home, whether they had homeowners insurance or renters insurance. So a lot of people have struggled simply because they don't have the proper documentation with them or that they're able to access. So I think it's an important thing to just, remember when you're thinking like, what am I ready for a fire in my community, or am I ready for a flood, is having all of your documentation as easily accessible as possible. So one thing that they're working on right now is expanding the range of possibilities for documentation. They're doing another round of housing assistance applications, but I will note that it still isn't enough. FEMA's funding for each individual and household is not enough for somebody to rebuild on. So it's very important for people to stay up on their homeowners insurance, or if they can get renters insurance, or if they can get homeowners insurance. It's really not enough to rely upon the federal government. And you're right, it's going to be very slow to rebuild in some of these communities. It is really slow. So Mayor
Casey,
King, you were going to add something?
Oh, I remember, because I'm like, be prepared. I had my car packed last year, even though, the danger was not here. But one thing is taking pictures. So I don't know for FEMA per se, but that's something that our insurance company said, that if you can just go through your home and take pictures, that can go a long ways towards helping with that inventory in a worst case situation.
Right, that's a really good point. And if you have a camera that can take video, then you can take video and store on a cloud storage site, so that even if you lose your phone or your storage devices in your home, that it's still around and accessible. And Howie, you were going to add something.
Yeah, I was going to ask you, Casey, if you would suggest that people have a safety deposit box in a bank, or scan all of their documents and put it on the cloud. Mm-hmm. So that they could retrieve those items in case of an emergency, no matter what the emergency might be.
Yeah, scanning and putting them in a digital format that's not stored in your home is a really important part of that. Yeah, I also want to add to that, time and again, we've heard that emergency notification, that like at the moment needing something is incomplete, I guess would be the most gentle way to say it. In Southern Oregon, there are communities that they have one cell phone tower that provides coverage for a community. And when that cell phone tower went down, they had no ability to get out that opt-in notification to people who then didn't know that they needed to evacuate at all. And in our communities and up in the Santiam Canyon, there were a lot of sheriff's deputies going door to door, which puts deputies at risk, and it really delays that response for community members to get out and get down a road that's still open. So one of the things that we have and that you can do, and the state of Oregon has actually taken over the funding of it, is to sign up for the opt-in emergency notification. But that is still not enough when cell phone service is down, or if people don't have a cell phone, they don't have that ability to get it to you. So one thing that emergency management at the state level is talking about is how can we bump up the like blast to a community, whether that's putting up road signs or the reverse 911 for these really particular situations where you absolutely need to know, and it's life and death.
Well, I know they have like tsunami warning in towards the coast, but I know a lot of us small communities, fire departments have like the all call for volunteers while they're do the siren. So that's maybe something that could be utilized a lot of places if people knew what that meant in certain situations.
That's a really good point. Yeah, it's a very good point. And Mayor Watkins, Ed.
Yeah, one of the things that the fires triggered over there was a conversation here. We're still needing to get more of a community-wide conversation about emergency preparedness, everything from go bags to neighborhood, basically kind of a neighborhood watch kind of communication so that you've got 2 or 3 captains on the block that are going to be coming around and staying in contact, reminding people. One of the things that they discussed in terms of radio type communication are the ham radio operators and how critical their activity is in those kinds of situations, because they're so much better. You know, they're not dependent on the cell towers, basically. So we're working. It's another thing. It's another little project we've got that we're trying to get started here. But we do have some folks in town who are very adamant about it. CERT training, the whole thing. Just trying to create more of a hyper-local, as in block captains and emergency preparedness network within our city and our community to cover some of that stuff. So that's,
yeah, and I think that so our emergency manager Brian Young has been working on with school districts on what it looks like to pre-position equipment in school districts or at a school within each of our communities, so that there is a place that has a functioning radio, and there's a place that has water and that has blankets, the really basic things. But you know, we've had emergencies, and that has delayed setting up some of this equipment, which is, you know, that's proactive, right? That's actually dealing with it.
In our city, that's one of the reasons that we're looking at and working towards a new community civic center. We're not calling it a city hall because it's not just a city hall. It's being put in as an emergency preparedness center. When we had the ice storms, that we could have folks come in and provide a warming center, which we don't really have right now. Our schools are not set up for that. So it becomes something much larger. And for all communities, I mean, that's a big thing we're going to be working on. We all need to be looking at it. So,
yes,
anyway,
absolutely.
I got it. I apologize. I need to scoot. My city manager calls, so I better
Me
go.
too. Well, thank you all of you for another very informative discussion this week. I really appreciate it. And remember that Howie, Encompass, Yamhill Valley, and Provoking Hope can use prepackaged food and water and other drinks for folks who are in camps and are quarantining. So with that, thank you very much, and we'll see you next week.
Thank you, Commissioner.